Welcome to the Combinations Podcast, the podcast on North Staffordshire Combined Healthcare NHS Trust. And in today's podcast, we've all come together to go green. And we're fortunate to be recording this podcast on Earth Day as our first green podcast. I'm Kyle, the digital content lead, and we're talking about going green. So let's first meet our guests.
Hello everybody, my name is Jodie Nichols and I'm the Talent and Leadership Manager here at North Staffordshire Combined Healthcare, also lead on one of the work streams that we'll be talking about in the next section.
Hi, I'm Ben Cooper. I'm one of the project managers in the TMO and I'm the area focus lead for travel and transport.
Hi, hello, I'm John Cousins and I'm Service Manager with the Transformation Management Office, and we provide oversight and support to our sustainability programme at Combined.
Hi, I'm Melville, Head of Facilities. What I'm going to be talking about is our way that we've moved forward with food and nutrition and food wastage.
Brilliant. So, yeah, lots of green characters. And what a day to join us on as well, which is Earth Day. Obviously, we're recording this and it's not got any visual, but it's a very gloomy Earth Day. But it's still Earth Day, but it's very wet, typical British wet Earth Day. But obviously, for the listeners that don't know what Earth Day is, John, do you want to explain what is Earth Day?
I'll try to, Kyle. I mean, quite honestly, I've been learning about Earth Day myself. I've not heard of Earth Day up until about a month or two ago. I understand that it's an environmental movement that's been happening since around 1970. I believe it's one of the largest recruiters to the environmental movement
campaign,
that's occurring across the globe at the moment now. And essentially this year, I understand that every year it has a different theme. This year the theme is Planet versus Plastics. So over the last couple of greener working groups, we've been talking about how best we could promote that theme.
And I believe you've been in charge of the Trust's Go Green agenda with going for Earth Day.
So do you know what? I can't take credit for that. Whilst I do lead on the greener working groups, it's actually been a collaborative effort. Today's work that we've been doing towards Earth Day, a collaborative effort between myself, a couple of our sustainability champions and our partners Growth Point. And indeed, some of our service users and activity workers who've all been working in partnership to create the display that's in reception today.
Yeah, so what have we been doing? What have we done today at Harplan's, because that's where we're currently recording this. What have we done to celebrate Earth Day?
So for Earth Day today, what we have been doing is collecting used yoghurt pots, collecting used plastic milk bottles, used plastic containers, and painting them yellow both within the Harpland site and at Growth Point, and putting them towards an amazing duck display. So we have what looks like a huge yellow bath duck in our reception with an orange beak, which is all made from wasted plastics, which have been painted yellow and orange, and the duck's got big black eyes with black eyelashes. It's on a blue base, like water.
It does look it's quite a big sculpture. Were you all involved? Did you all chip in, or did it just turn up on the doorstep this morning?
A lot of us have been trying to encourage teams to get involved. So lots of those teams, that includes some of our service users, some of our kind of patients and the ward-based teams. They have absolutely led this from kind of start to finish, from the vision that was about 6 weeks ago to bringing it to fruition today. So I can't claim any credit for actually the implementation of that. And I think it's brilliant that actually this is about everybody. Everybody has an opportunity to provide something and to contribute to this agenda, because it's so important to us and future generations as well.
And is there anything else that's gone on at Harplan's for Earth Day?
SOCO have supported us by collecting a lot of plastic bottles
to help build the
milk
duck.
bottles to help build the duck, and supported us for our activity workers to creatively paint with their clients.
My question is that duck going to be recycled? What's going to happen to it?
I know,
because you've already recycled it once.
And we didn't. I don't think any of us really anticipated or expected how amazing it would be.
It's got really good shape.
I don't know what's going to happen.
I'm sure there's a photo on our socials where you'll be able to see the duck if you want to see it. I can't put it in the description for this podcast, but I'm sure if you saw it floating around, no pun intended. But yeah, it's quite an impressive sculpture for well, obviously a lot of people getting involved. We mentioned there's external stakeholders have got involved.
Yeah.
And also for it to be made out of recyclables means that it's not really been money spent on it, really, has it, if it's something that's already out there.
And there's another stand up there as well, which I think a couple of the inpatient units have contributed towards, which is essentially promoting recycling, seeking recycling ideas, seeking to learn ideas, initiatives that are occurring in other areas as to what other teams are doing to promote sustainability, growing gardening ideas. There's another stand, like I said, which is very informative as well.
And it is good to see the staff as well. They're putting not pledges, but what they do to help recycle. Obviously, in my life, I do a lot of recycling, and I assume all of you do nowadays. You know, I've gone to the level where I've got a bin underneath the sink where I put my cans, so they just do not go into general waste, because then it just gets chucked in our blue bin, which is our recycling. And I'm sure we do something similar, but it's good to see the staff also have wrote that down, because it also shows the practices that they do in and outside of work.
Yeah, one of the things we've certainly found is that, you know, having it on the main entrance of Harplands, it's drawn people kind of to come and have a conversation about it, and that's so important about raising the profile of, you know, what the simple steps are that everybody can do in their own homes as well as within the workplace to reduce, recycle, reuse those things that we've got. And I think it's getting that conversation, and that's why we wanted to bring that to the podcast here today. You know, getting that conversation going about how everyone can get involved, and the smallest of contributions can really mount up as well.
And that's
so not everybody has to make a massive duck at home.
No, that's not an essential part of getting involved. So.
But it's a really like you say though, it's a really creative way of starting a conversation whilst actually reusing a lot of different materials, and I think the activity workers have been really creative in the way that they've reused discarded items to create really fun, interesting, engaging activities for patients and service users on the ward to actually then start to have conversations, not just with ourselves but with patient groups and things like that as well.
Yeah.
I think the duck signifies also as well the coming together of everyone recycling, because we've all had to, you know, give a milk bottle or paint it to build the end product. So, and that's what awareness days are good for.
Yeah.
You know, this Earth Day, I've known of it for a couple of years, but never really delved into it like what we're doing today. But I like to have a day where we've all sat here and we've talked about going green. I'm learning more about how the trust's going green, and we're all passing little tips across to each other as well. So obviously we've got the Proud to be Green campaign, I think is what you said, John. So can we talk about what is the Proud to be Green campaign?
Yeah, so essentially I think that over the last several months, it's absolutely been the case that many aspects of the sustainability programme, many aspects have been new territories of work for a lot of our, staff across the trust and indeed across the region. And I think we've all been trying to learn and get familiar with the various aspirations and deliverables aligned to sustainability and Go Greener. Of course, we work in collaboration with Staffordshire and Stoke-on-Trent ICS, with our partner providers within that system. And I think we felt that whilst there are a number of KPIs, deliverables aligned to the system work, we really felt that we wanted our work at a local level to have meaning and value for our workforce within Combined. So for that reason, we considered ways of how best we could engage and promote participation from our workforce in working towards our targets over the next 12 months. And from that was born a 12-month comms plan, which we decided to call Proud to be Green, because we know lots of great work is going on already. This idea for the 12-month comms plan evolved, which is essentially developed to make this huge programme of work more manageable, more bite-sized, and to break it down into different quarters, and to have meaningful smart targets that champions could work towards over the next 12 months? I don't know if I'm fair.
No, explain. Yeah, so we've got basically a year of a whole end goal, but we split up into different months where we're going to be promoting and doing tasks. So So we're in the first quarter, obviously.
We are in the first quarter.
So what have we started to do? Where have we gone?
So in the first quarter, we're obviously working very, very closely with our comms team, which is why you're here, Kyle, to ensure that the messages are spread,
far and wide,
with our own internal staff, with our service users, with our carers, with the local community, with partners across the system, and we're looking at a number of different comms strategies to ensure the messages are conveyed in different formats. The focus areas for quarter one are aligned to workforce and leadership and adaptation. So perhaps Jodie, you might like to talk about some things that we're doing aligned to workforce and leadership.
No problem at all. I mean, the key aspect of the greener plan is making sure that actually we engage people, and we are focusing on things that matter to our workforce and our people. Only that way you're going to actually get people bought into some of these ideas. So for us in the workforce and the leadership space, which is in this first quarter, a few key things that we've been doing. Many people will have seen in the Trust comms around the sustainability reward scheme. So individuals have certain criteria that they need to meet. They would submit that as evidence of having completed those things, and they get a reward at the end of that. So we've got about 18 teams so far, which approximately reaches about 450 people across the Trust in terms of teams that have currently got the bronze. They've achieved the bronze award. Now they're working towards their silver. So I think that's kind of one of the first aspects that we did. We wanted to really get people involved in not only just their ideas and actually physically doing something. And that can involve something like inviting the TMO team or somebody, one of the sustainability champions, to do a bit of a talk to their team meeting or have it as an agenda item on their team meeting. So that's one of the first things that we did that was really important to get people bought into it. The second one was about increasing the appetite and increasing the numbers of sustainability champions that are actively engaged in the process. So I think when we checked last week, I think it was about 80 individuals who've now got signed up as sustainability champions, which is brilliant. And I think that shows the appetite that our people have got for this particular topic.
And what is a sustainability champion?
So sustainability champions are there to champion the cause of greener NHS and sustainability, encouraging people to talk about that as part of their meetings, encouraging people to recycle, encouraging people and being that kind of information, font of knowledge where all of these things are shared.
And would they influence projects, if you're thinking about it? You can go, what about from a sustainability point
Absolutely.
of view?
It's all about them championing the cause of greener NHS. Role modelling, so some of our sustainability champions have done kind of swap shops in their own spaces of clothes or books and things. And I think that's just some of the really simple things that bring it to life. It reduces the amount of kind of fast fashion that people are buying. It's a great way of recycling some of those some of those things that people are doing. So there are a few of the things that some of our sustainability champions do. We also have a series of kind of presentations and going out to the team to meet and greet some of those teams to really bring it to life for them. So, for example, our next Leadership Academy is all focused around sustainability, which is coming up in early May. We've got some of our leadership programs have now had presentations or got presentations coming up where members of the TMO or sustainability champions are coming to talk about some of those kind of how they can get involved, the engagement around greener NHS and sustainability. So they're just a few of the things that we're doing in that space to really bring the workforce piece to life. Don't be surprised as well, we are also encouraging people to think about, when it comes to job interviews and some of our information that goes out on Trust website. We want to make a real statement of intent as to how serious we take our greener NHS pledges and what we want to commit to in that sustainability space. So, don't be surprised if in interviews you start to see questions creeping in there around sustainability in the near future as well.
Well, it is our future that we're
Absolutely.
working towards, isn't it? And obviously the greener NHS has been on the cards for a while.
Yeah.
And this is us doing our bit, isn't it?
Yeah.
So we've got obviously our sustainability champions. You said you've got is it the bronze course?
There's the Sustainability Reward Scheme where people are working towards their bronze, and we've got Combined Connects, which is one of our leadership programmes where they're all having a dedicated section where they're looking to engage in that content.
And how many sustainability champions do we currently have?
So we've just topped over 80. We just last
That's
week.
a lot,
I think
isn't it, really? If you think how they're going to be spread across all the different sites, there's going to be... And then any of you here, sustainability champions?
Oh, yeah.
Are you all sustainability champions?
Yeah.
Wow, that make me feel like the odd one out.
I'm making sure everyone got badges on.
It's on the jacket.
So obviously I try to do my bit as well, making sure lights are off. Recycling in the office is a big thing that we try and do. I get called out all the time for putting like cardboard waste in a normal bin. So it's I don't anymore because I'm scared too. I'll go find the recycling bin, get a little few more steps in. So what else has happened in Q1?
So the other area of focus for Q1 was around adaptation. So essentially, adaptation is about ensuring that our systems and our infrastructure can continue to operate despite changes to the climate. So we know that there's an absolute requirement for the NHS to continue to be able to operate, and like I mentioned, deliver its services. So essentially, in collaboration with our partners from across Staffordshire and Stoke-on-Trent, and indeed with participation from the local authority and emergency services, we're currently in the process of developing an adaptation plan.
Does it mean like get everyone on board on the same level? Is that sort of where we're going with that?
Yeah, and absolutely it's about recognising the contribution that every area, every department, every organisation can bring to those extreme.
And is that to get the
Fair
green?
weathers.
Is that trying to get the green values in to make it more second nature?
Oh, absolutely.
Yeah.
Yeah. So within that, the plan would absolutely incorporate, lower carbon options, but essentially, like I said, I think it's more about emergency planning. And
if you think about it, does that mean if we're all on board and the systems are all on board, and then we find like a stakeholder or somebody who doesn't, we can support them as well? And help
Yes,
them
absolutely. It's
integrate
all
it?
about working together in partnership, and that's what we strive to do in all of the work that we're doing around sustainability. Rachel Burks is our area of focus lead for adaptation, whereas Jodie's our area of focus lead for workforce. Unfortunately, Rachel couldn't be here today, but it's the case that the TMO and Rachel and the local authority are working very closely with partners.
I thought you were going to say they were very busy being green.
Well, I'm afraid it's being green.
So that's Q1.
Yeah.
So that's what.
Adaptation
Yeah.
and workforce leadership.
What are we working towards as we move into Q2?
Ooh, I'll hand over to Ben and Anne to talk about Q2.
In Q2, we'll have a focus on travel and transport. This is a really new and emerging area for the Trust. At the minute, we're developing our travel and transport plan, again, alongside colleagues at UHNM, because our Rollstoke campus is right next to the Harplands campus. We have been working alongside the local authorities, for example, because they've got big highways teams and they manage all of the bus service contracts. So we're going to be looking at ways in which we can engage with the bus companies to improve access and connectivity to our main sites across North Staffordshire. We're going to be working with our OD leads to explore opportunities for promoting and encouraging sustainable modes of transport to work. So we're facilitating that modal shift from getting people out of cars and onto bikes and onto foot as well, so that we're going green in a big way with the way in which we get to work. Each year across the NHS we have about 250 million miles in commuting, and that can lead to a huge amount of CO2 going into the atmosphere. So we need to really focus on that, and we'll be working with our estates colleagues as well to explore how we can make adaptations to our sites to create a more supportive environment for those people that want to be active in the way they get into work. So if you do cycle into work, how do we enable that by having appropriate changing and storage facilities on site and things like that?
And is this, I know this is going back to Q1, but is that why workforce came first? Because you've got to get them on board to be green, to get them in the mindset before you try and not push this on them, but try and, promote to cycle to work or, be greener.
Yeah, definitely. I think for some people that change might be quite easy. For others, they may want to do it, but it may be slightly more challenging. And so what we need to do is we need to appreciate that people have got lives outside of work, so they've got kids and you've got to do pick up and drop offs and things like that. So people need their cars. So what we're really trying to do is engage people, but then encourage people to take appropriate steps that aren't going to
is it about being
their life too
just
much.
greener in general? So you mentioned obviously some people I wouldn't be able to get to work or to base without a car because they don't accept bicycles on the motorway. But but I could come to here at Harplands, I can car share, and is that being green?
Absolutely. So if you're able to car share, great, then that's something that we absolutely should promote, and there are going to be we're going to explore opportunities going forward to encourage that more comprehensively across the trust. There are various apps that you can sign up to as a trust that will enable different people from across different sites to upload their details, and then they can potentially car share with a colleague that works the same shifts but maybe on a different ward.
I was just thinking more in general. If you if you can you just just get in that mindset of, can I just jump in with you if we're coming back here?
Oh yeah, definitely. Yeah,
that's what I was thinking more from you. But I know there's obviously systems out there that I don't know if it's this trust, but I know certain trusts allow you to claim mileage if you do take a colleague around, because that happened to me.
And that's why we need to engage with our HR and workforce colleagues so that we can explore all of those opportunities to incentivise people moving to lift sharing or to cycling or to walking or to using the bus and things like that. It's not just about us telling people, it's about creating an environment that would encourage people to...
I think going green is a mindset, isn't it? You've just got to be in the world and understand it, like how you can be greener.
Absolutely. I mean, here's the thing. It's very easy in the morning to hop in your car. To get on a bus, you have to sort of think about it a little bit. So our challenge is, how do we make that as easy as possible? And we'll be working with our local authority colleagues to try and do that. So they're working on a scheme at the minute that will bring all of the bus timetables for the 6 bus companies into one place, so it would make journey planning a lot easier. How do we work with the bus companies and colleagues at Royal Stoke, for example, to make sure that the bus timetables mean that people can get to work on time, so the timetables align to shift patterns and things like that. So what we need to try and do is make life as easy as possible for people and make that transition as easy as possible.
It's amazing to hear that it's not just the detail of, you can get the bus to work. The fact that you're working with bus companies to adjust times and things to work better for staff.
It's something that we're hoping to do, and doing that in partnership with Royal Stoke, for example, will help to generate that engagement with the bus companies, definitely.
And is there anything else in the next quarter?
Of course, for quarter 2, there's also a focus on food and nutrition, and there's been some great work going on within food and nutrition, and Anne is our area of focus.
Anne, tell us about the nutrition and food then.
Very much focusing in this quarter 2 on our food wastage and making sure that working in very close partnership with Newcastle Borough Council, who are quite excited to work with us, and what we're exploring is the options of how our food wastage, particularly on the Harplands site, where obviously we generate more food wastage, as our other inpatient sites is very much cook serve and very specific to the client needs, as to how we can actually dispose of the food using the anaerobic food digestive system.
Oh wow.
And to see if it is that their contractor that they use will engage with the trust. So it's really exciting times. What we're currently doing is obviously measuring all types of waste, and this is food spoilage, kitchen waste, bulk waste at ward level, and also plate waste on the patient. So we're recording that, and that's what we're feeding in now to Newcastle Borough Council, and just hoping that they will be able to work with us and we can engage with their provider and take on board this great initiative. Whilst we've done a lot of work with our menus, on site, particularly at the Harplands. We've introduced a lot of plant-based menu choices and vegetarian, and there's always one option, at least one option on at lunchtime and at supper time. And in addition to that, we've got a great a la carte menu that promotes plant-based and vegetarian and vegan menu choices, which is always accessible. And again, we've got plant-based menus that we have on the menu and available in the cafe. So that's really great that we're striving the way there, and we had a very successful taste testing in December, where we encouraged a lot of staff to come and taste test the menu choices that we offered to our patients on our 4-week menu cycle. And I think it's really fair to say, John, wasn't it, that people were very impressed.
It was really successful.
And a very successful
Even
taste
some
test.
visitors tried it, didn't they? Everyone complimented and praised
So I
the
will
food.
say that Serco worked very closely with us as we're designing the menus in conjunction with our dietitian, but always ensuring that we've got these choices on available. So I do feel as if we are striving the way. And our recent place scores that came out, we are the 5th in the top 5% of the mental health trusts for our food quality, which is great.
Yeah.
So really proud of. A lot of work has been done across trusts in looking at food wastage, and one of the recommendations is that we look at the crockery that we serve the meals on, and I'm proud to say that Combined Healthcare, we have had bespoke crockery for, to my thoughts, 12,
You should hope for it being
14
in
years.
Stoke-on-Trent.
Yeah.
honestly,
Of our design, and we've moved away years ago from the traditional buff coloured, rimmed, that then, you know, it was buff, it was pink, it was green, it was blue. But we have got bespoke crockery which enhances the meal experience of our clients. So really proud of
Yeah,
that.
it's to do with the rim, isn't it? The rim, the rim
So obviously
passing around
if
the
it is
plate.
cutlery looks attractive, that tempts and can encourage as well.
I thought you were going to
again,
say more
hopefully
plate
reduces
size,
food
shrink the
wastage.
places and then they
Yeah.
might eat more. Or
Apparently with streets ahead. That's what we were told by Newcastle.
But it's
Yeah, we are.
It's amazing, isn't it, to think, and now I can see why you've split it over those 12 months, because they are massive topics. You know, they're all different areas. I never thought about food wastage. I think about the basics like recycling and trying to cut down on emissions, but like it's these other things that obviously run a
Yes,
business.
they're great exciting times, and Serco are very keen to work with us as well from the Harpland site with the food wastage, as well as working very closely with John and Newcastle Borough Council.
Wow.
Can I say, Kat, what really, really comes through to me in all these conversations that we're having from Jodie and Ben and Anne, Anne was talking about the support that we've had from Serco in terms of collecting empty plastic bottles for our Earth Day display today, the support that we had from Serco in delivering the plant food-based testing, the support from Growth Point input in all this partnership working, the meetings we've had with local authorities, Staffordshire County Council, Stoke-on-Trent City Council, into Newcastle, like the passion shared by so many different agencies and teams and
it's
organisations.
not just us doing it on our own.
No.
It's a really broad network of really important partners that are coming together to support us to deliver our green plan. So the local authorities have been really engaged to support us in any way they feel they're able to. There are some great small organisations like Staffs Wildlife who are really keen to promote their activities, not just from an environmentally sustainability perspective, but from a mental well-being perspective, because there's some really nice parts of Stoke-on-Trent and Staffordshire that actually getting people into nature is a really positive thing for people's mental well-being as well as for the sustainability agenda. There's a really cool little organisation in Newcastle called Into Newcastle who are really good at promoting cycling and walking and have a really good understanding of the cycling networks around this area, which means that we're able to promote our agenda more effectively to staff and to patients, to encourage them to use those networks.
I think that's the point, isn't it? It's not us, it's everybody getting involved, and it's just getting on that sort of level to say, like, we're all green, And then once we've all got to a set level, it's then pushing forward to be greener. So obviously I imagine after the first 12 months, there's probably going to be another 12 months, but completely different challenges.
Yeah, and one of the things that we're really, really wanting to encourage people is to think about how they can get involved. And there's multiple different ways that people can get involved in the greener NHS and the working. You know, there's a real push across the organisation at the moment for completing the environmentally sustainable healthcare, which is some of the e-learning modules on the LMS. And the more people we can get that are aware of kind of what the greener NHS targets are and sustainability, you know, the better. So that's one of the really simple ways that everybody will have access to. As well as kind of visiting the sustainability platform on the CAT pages on the intranet. You know, you can find out more about lots of different work streams that are taking place, and you know, submit your ideas. If you're doing some great work out in the trust, we want to know about it. You know, we've got our sustainability forum where you could submit some of that information about what you're doing. So I think, you know, there's lots of different ways that we want to encourage people to get involved and to share what they're already doing, because we know people are doing it. It's just knowing kind of, you know, how we can tap into that and make sure we can share that great news with wider people across the trust as well.
I think I'm going to have you as a co-host because you've just done the last bit of the podcast for me. I was going to say anything to wrap up. Brilliant. You know, it's great to see where we're going, and it's good that we're going green. So I think that wraps up, I think, our Earth Day celebration for going green. So thank you very much for all coming on the podcast. Obviously, you can follow us on SoundCloud, Spotify and Apple Podcasts if you're new to the podcast. But yeah, I think that'll do us for today. So thank you for listening, and we'll come back and be green in a couple more months, won't we? So obviously we're still going on, but we'll come back and do another podcast. So thanks for listening.